Dr. Dennis Young, and I'm here with the Carlsons from Fairbanks. And Cherie has struggled some with severe tinnitus and ringing in the ears, among a lot of things, right? And Bradley's had a little bit of that and some back pain, but Cherie was the reason they came down here to Anchorage, Alaska, and we used the Atlas Orthogonal adjusting protocol, the upper cervical specific protocol on the problem. And basically, Cherie, just tell me what a little bit about what you went through and how it's been, and any things that were kind of surprising.
Just the treatment here, or prior to the treatment?
No, go ahead and you can share.
Yeah, okay. Well, it was from a car accident, and about 6 months after the car accident, I had ringing in my ears, and it would only go away if I had a chiropractic adjustment, but it would come back immediately. And
so you'd get like some hours of it not being so bad,
yeah,
and then it would come on back.
Yeah. So I'd maybe get a good night's sleep that night, and then, but as time went by, with the progressive lack of sleep, I was between this back pain, the neck pain, and the ringing in my ears, and the buzzing sensation, the dental drill feeling. It was to the point where I always had to take stuff to put me to sleep and keep me to sleep. And I took ibuprofen throughout the day. I had a thing about not wanting to take painkillers because of the side effects. I saw several doctors, an ear, nose, throat specialist. I was referred to the tinnitus clinic in Portland. And
that's a nationally known, well-known
like
center.
The best on the West Coast.
The best on the West Coast, yeah.
Like from Midwest on, probably.
And they did fit you with some
noise maskers, yes.
Noise maskers, which helped.
Yes, their recommendations were see a spinal specialist, because they saw abnormalities in my spine that they said that they thought was an issue, probably the issue, but not being spine specialists, they couldn't say for sure. They prescribed the noise maskers and benzodiazepines to help me sleep, to shut down my brain so I could sleep, which triggered migraines when they wore off. So, or headaches, minimally headaches, worst case migraine.
Yeah, because you were walking around with just a pretty constant amount of neck pain and headaches every day.
Yes, and then my day revolved around managing that. Stretching, resting, icing.
Nothing but that.
Yeah.
And then when Brad had his shoulder surgery, and I had to focus on because he was laid up, getting him, making sure he took his meds and ate and whatever, it really was painful for me, and I realized how I couldn't function day to day. I always thought, eventually I'll go back to work in an office and get my own job back or whatever. And I realized, oh no, I can't do any of that.
They actually sent you to a
psychiatrist
to try to
deal with my life changes.
Yeah.
Life changes.
Yeah.
And she gave me an anti-seizure medication, and that was horrible. And then they gave me a high blood pressure medicine, thinking that lowering the blood pressure in my head would stop the ringing. No.
Okay.
It actually made it worse. The second night, it actually made it worse. And so, so then we originally, this was about a year and a half after the accident, Brad was searching online looking for upper cervical options, I guess, and he found the NUCA site.
Started searching for whiplash causes, which led to NUCA website, and then we kind of put that whole idea on the back burner for a while because we were still in the middle of all what she just described.
Trying to find an answer.
This doctor can help, that medicine will help.
And there was only one chiropractor in Anchorage at the time. That was affiliated with NUCA, but was not certified yet.
He was working on it, but
and then nothing in Fairbanks.
Yeah.
And then and in Fairbanks, my range of motion and my physical fitness, I don't want to say stellar, but compared to what their expectations are, because the kind of clients they have, the chiropractor I dealt with there had a hard time believing I had, until he did the X-ray. He did an X-ray of me and said, "Oh, you're yeah, your Atlas is, your C1 or your C0 or something is crooked, but he doesn't do that. He's not certified to do that. He won't touch it, but he can do regular adjustments on other things for me. But my range of motion, he's like, well, there's not a whole lot wrong with you, you know. But he knew that, he was actually the first one who told me that, yes, because of the whiplash, I do have upper cervical problems. That's something I want to look at. And his reference was to someone in Seattle. But for us, that wasn't really an option at the time. So, yeah, then...
Between my recovering from shoulder surgery, and then this was right about the time the psychiatrist was giving her these experimental drugs, and was just the side effects were horrible.
And you were recovering from shoulder surgery, so you had some time, so
Yeah,
you got on the
well,
computer.
And he actually got,
Yeah,
he actually got to see what my day looked like.
That's good.
I saw her
Yeah.
all day.
Yeah, he saw when he goes to work, you
Yeah.
know, but he wasn't at work, so he got to see what I really do all day when he's at work.
Yeah.
I saw her mornings, how long it took her to get going, the frustrations she would feel stretching and trying to just get to where, okay, now I can handle the day, which was
Okay.
usually around 2 o'clock in the afternoon. I just said, enough's enough, and I don't care what it costs, we gotta find a different direction. And so I said, we gotta look into this NUCA thing again. We had already talked to Scott Rosa back, and he was in New York, you know, he's at the top of his game. And so I told her, if we have to go rent a place in New York for a month and go there, we're gonna do it. So like you said, I started internet searching again.
Yep.
And I looked up, mainly his method of how he prefers to do it, which was Atlas Orthogonal, however you pronounce it. And so I literally just punched that in to find those doctors again and see if there was one closer to home, Seattle, and that's when I found Pairmore Synergy Chiropractic.
Yep.
And I was like, wait, how come I never saw this before?
Yeah, well,
And
it was,
that led to us making the phone call and her discussing
yeah.
with you, and we were amazed that you were board certified and had all this experience, and why didn't we find you before? Now we know why.
Okay.
Because
It wasn't here.
you're
Right.
relatively new to Anchorage, even though
Yeah.
you have a ton of experience, and
Yeah.
so that was a whirlwind week and arranging.
Oh,
Well,
yeah, and
so-
Sheena said, well, how soon can you be there? I was like, well, Monday.
Yeah.
That's great.
Yeah.
So you got here, and when we examined you, we said, well, yeah, you got an Atlas problem. You got a little bit of a hip problem from the car accident. The car accident was a side hit, what they call a T-bone, where you got jerked real hard to the side toward the passenger side while you were driving.
Yes, I was hit
Yeah.
from that way,
And so you kept some hip pain
Yes.
along with these other symptoms.
yes.
Okay, so after we got you adjusted that first time, even though it was just adjusting your hip, what did you notice?
My tension headache went away, because I would have daily, well, I don't want to say daily, is it daily when it never stops? Like, you know,
All day.
is it like all day, every day, you
Yeah.
know, all the time, pretty much? And that went away, and I was like, wow, I don't have someone slamming me on the back of the head, that's cool. And then I felt really uncoordinated. Remember I told you, I felt like I was walking a green horse, like all,
Yeah.
a young horse, all uncoordinated and walking and trying to get a stride. And yeah, it was kind of weird.
I
Yeah.
just want to interject. We came here, you know, focused on the Atlas.
Yeah.
Yeah.
And that first day, I was overly impressed at the way it almost was like you were just right up front discarded focusing on that.
Well, you're doing all
The-
forensics, you know, you had
Yeah.
all your.
And then this is just being honest here, because we talked about this after we went back to the room that first night. I was so impressed the way that you almost looked at everything but that first, and including discovering the issue with her hips being out of whack. She was like, well, when are we gonna get to the Atlas part?
Yeah.
But then we went back, and just after that first adjustment, all these things she described were already a huge benefit. And so we were talking that night, and I said, I really feel like this guy is like building the foundation under you before he adjusts you up top.
Sometimes.
And yeah, in this case, there were two combinations, obviously. So to see that much result just from adjusting your hips right up front was very impressive to me.
Well, yeah,
That you
but
even looked at that when
Yeah.
nobody else did.
Wait,
And,
he you adjusted it in the afternoon, because I remember all you did was diagnostic stuff and evaluations in the morning.
Yeah, with the protocols that we use, the x-rays are important because we actually use those x-rays to devise how it is we have to treat something after we've found it on the patient. And so it just takes time to do that.
Yeah, so that was impressive that when we came in, you didn't just adjust me, you actually like studied and looked,
Yeah.
read
Very
my file,
complete.
you actually read the reports that
Yeah.
they sent.
Very complete and very thorough.
Yeah, and all the different measurements that were taken.
I am the biggest skeptic. I
Oh,
mean, as I
that's-
told you, I have never believed in or gone to chiropractors, and I was so impressed, obviously.
Well, with
I
these,
signed myself up for this, and I have benefited as well. So.
yeah, with these procedures that we use, you don't have to be a believer. It'll work anyway.
That's a fact.
Yeah, it'll work anyway. Now, after we got your Atlas adjusted though, you've noticed in the past several days that you've been able to dispense with the hearing,
Yeah,
with the
actually.
noise suppressions.
Yeah, after, yeah.
You're able to sleep without medication, which is the first time in years you've been able to do that. You've gone to the museum when they were having a field trip for a bunch of kids, and that noise in the past echoing around
Yeah.
would have just been painful, you said.
Yes.
And it was okay.
Yeah.
Yeah.
Yeah, walking around the mall in the past, it would have been, even with my noise maskers, it was uncomfortable.
Good.
Because anything that was louder than the masker was like,
Well,
oh.
Brad, you could be in a lot of trouble now.
No, like I told you earlier, that after the Atlas adjustment, that very next morning, when we woke up, I just looked at her and I said, "How do you feel?" And she's like, "Why?" And I said, "Because your face is just stress-free. I could see it. Her eyes were just relaxed, and she normally wakes up very just stressed looking, I guess. I don't know how else to say it. It's just, I saw it in her eyes. Just complete relaxation around her eyes, in her eyes, no bloodshot eyes. I knew right then something.
Well, I remember you came back the next
Yeah,
day and you
yeah.
said, I had to turn down my,
Yeah, I had to turn
the
it down.
volume, yeah. And then within probably that afternoon, you were just, weren't using them, yeah. Well, that was impressive. That was very impressive. So Dr. Sweat has taken the last, 60 years and developed this instrument. And he's in Atlanta, Georgia, and he's 86, and he's still teaching this, right? Just let him know something about that.
Wow, that's incredible. I'm amazed that more people aren't aware, and this isn't more mainstream, like, it's not common.
You'd think
really-
this would be
yeah.
a good thing to check on most everybody.
Yeah, and that, like, neurosurgeons, don't, it's not even an option. And I'm just so grateful that this is an option. Otherwise, I'd be, like, on prescription meds all the time. And I'd be going to the psychiatrist to learn how to deal with the side effects of those meds.
Yeah, I would
So,
add to
yeah.
that it's funny you ask these questions, because we talk about this in the hotel room,
Yeah.
and we were saying how it seems like this should be taught from the ground up in all chiropractic schools today. Like, this isn't the answer for everyone's problem, but it's another tool from top to bottom, whether it's x-raying the entire spine all the way down to the hips, which a lot of chiropractors
They don't do.
did not do for
They
her
don't do.
earlier. Considering all aspects like you did, and not just going, oh, let's just start with the Atlas, the fact that you what seemed to me like put the building blocks into her hips to be able to hold everything after you went there and straightened it out,
Yeah.
was really important and has made a huge difference. And as well as you did with me. And I didn't even realize I had an issue, so.
Yeah, we say that,
I've been lower back pain free every morning since the adjustment, and that is just a simple fact.
but I don't think we really adjusted your back, maybe a little bit.
You adjusted one time?
One time, but
and
we
then
just
you
adjusted
just-
your Atlas.
Just the Atlas, and
And the last couple of days, you've been doing all this cracking and
Oh, I've
popping on its
definitely-
own. Yeah,
it's been cracking on its own, that's
Yeah.
so true.
it's resetting itself. Yeah, we say that people, not everybody needs to be
No, they don't.
adjusted with an Atlas orthogonal instrument, but everybody needs to get checked.
It's the
Because-
complete diagnostics from top to bottom,
Yeah.
and the fact that, between the x-rays that you do and, the tools you use is a measurable thing that you
It's
can show in
quantifiable.
3D.
Oh, yeah.
And people, you can see your own results, and you feel very confident about the Atlas adjustment, the way the procedure is done, because you know it's a measurable thing as well. And
Mhm.
obviously, it's your skill that sets the degree and angles of which you use it.
Yeah, we like to think, yeah.
Yeah, but, yeah, you know, it's always a constant practice, but, it is nice to know, whenever something's done by hand, you always have that thought in your head, how good is that person?
What kind of day are they having today?
Yeah,
Well, it's, Dr. Sweat actually, taught Dr. Grostek's work, which NUCA is based on. But Dr. Sweat, about 60 years ago, he said we need to develop an instrument where all chiropractors could take and be
Yes.
able to specifically and accurately adjust an atlas.
Yep.
And the NUCA procedure is a wonderful procedure. It's being
I
very
love
well.
NUCA, their
It's
information they put out is fantastic.
It is terrific.
Very educational,
We like the reproducibility of the machine
yeah.
and that sort of thing.
It almost seems like the chiropractic world needs to come together and believe in this method, NUCA and all, and go away from the hand adjustments, because they all have the same knowledge, it's just getting used to the tool.
I don't think Dr. Sweat can make enough instruments.
Yeah, that's quite possible.
Well, it's so good. I'm so glad. It's really warms our hearts when patients
Yeah, I
get
mean,
some
we are
results.
at kind of the small portion of the United States up here at the end of the line, and to have someone like you here in town is,
Well,
we appreciate it.
I gotta say, when I first came to Alaska, I didn't even want to get back on the plane to go back to pack my bags.
Yeah.
Really?
That's right. It's very strange. I looked around at all these crooked people in the airport and
Oh,
said,
yeah.
there might be a lot of chiropractors here, but there's a
Oh.
lot of work I can do.
Go up to Fairbanks. Yeah.
Well, we might do that a day or two. Well, that's great.
Thank you very much.
Yeah, congratulations.
Thank you.
So good to have you.